When
Okay, my name is Abby Boutwell. This is my presentation for the opioid crisis module. The people I have joined with me today are Tucker Calzert, he's a registered nurse, Jace Aldridge, a respiratory therapist, Emery Browning, who's also a registered nurse, and Faith Drain, who is a registered nurse. So this is my PowerPoint. I did it on threats to health, the national opioid crisis. And again, my name is Abby Boutwell. The objectives for this presentation are by the end of this presentation, the learner will be able to describe the national opioid crisis, discuss the impact of opioids on people in the United States of America, understand the impact of the national opioid crisis on healthcare, be able to identify signs and symptoms of opioid abuse, and identify ways to make a positive impact and make a difference in communities dealing with the opioid crisis. So, the national opioid crisis is one of the most severe public health crises in history. This includes substance abuse, drug trafficking, overdose. Greater than 727,000 people have died from an opioid overdose from the years 1999 to 2022. It was originally driven by addiction to prescription opioid analgesics. Um, the fifth vital sign pain became super important, and doctors started to prescribe or increase prescriptions of opioids to the undertreatment of pain in 1990. And then, although they are therapeutic when used properly, these have progressed to opioid overdoses. And then there's three waves that progress to heroin. And then the third wave was illicit synthetic opioids like fentanyl. And here is a graph of those three waves. The rise of prescription opioid overdoses in 1990. And then wave two was it moved to heroin. And then wave three started in 2013 when synthetic opioid overdose deaths started. And I did read that there is a fourth wave where they are starting to use psycho drugs along with the synthetic. So the impact on healthcare, the opioid crisis on healthcare has impact financially. So effects are cumulative and costly. It strains not only hospital administrators, but families of the addicts, workplaces, healthcare systems, states, and communities, all causing a significant financial burden on those. Between 2001 and 2017, healthcare costs related to the opioid crisis reached 215.7 billion. Um, and that is including emergency room visits, ambulance costs, and then the use of the reversal drug naloxone. Its impact on resources. Obviously, healthcare is already underprepared and understaffed for most things, but the treatment system for opioid crisis is definitely underprepared and understaffed. Most healthcare providers lack necessary training to address the substance abuse disorders. So, integrating substance use disorder services like screening for early risk factors and ensuring all Americans have access to treatment services that could have the power to substantially improve the outcomes and the opioid crisis itself. Opioid crisis in healthcare, its impact on health. The impact of opioids due to the risk of overdose and death has highlighted the importance of prevention, screening, and treatment in healthcare systems. While there are deficits in resources, things have certainly improved as the opioid crisis has increased throughout the years. Funds have been invested in implementing evidence-based strategies, so this includes expansion of mental health and substance use disorder services that focus on treatment, increased prevention and awareness of opioid misuse. Education is super important when dealing with the opioid crisis to prevent more. Integration of substance use disorder services into primary care, so putting it on the front line of treatment to recognize opioid crisis and addiction. So, signs and symptoms of opioid abuse in lay people, such as any normal person or addict, small constricted pupils, drowsiness, weight loss or gain, responsiveness, flu-like symptoms such as nausea, vomiting, sweating. It can also cause behavioral changes such as a change in attitude and personality, and even avoiding contact with family or friends. Um, Also, opioid abuse is prevalent in healthcare providers. They would, of course, have the signs and symptoms of any layperson, but They would be falling asleep on the job, volunteering to administer the pain medication themselves, financial, relationship, family stress, incomplete charting, errors in paperwork, and frequent bathroom breaks. So it's important to recognize those signs and symptoms um, in your patients and as well as your coworkers as a registered nurse. So combating opioids start to help. Um, Increasing awareness and recognition of the current public health crisis is huge because primary prevention is first and foremost being aware and educated on the problem, emphasize and expand access to evidence-based treatment approaches and interventions, focus on the populations that are at risk, so family history of substance abuse disorder, adverse childhood events that could cause addiction in adolescence and adulthood. Psychiatric disorders also play a big role, as well as providing screening and treatment on those at-risk populations, and even in emergency room departments or just clinics would be good too. Educate patients who receive legitimate prescription opioids. While I stated in the beginning that opioids are important and therapeutic when used appropriately, it is important to educate patients who receive those medications, like signs and symptoms of possible addiction, um, and how to appropriately use them and when to take them. If all possible, use non-pharmacological treatments first, such as like therapeutic touch, relaxation techniques, heating pads, and if needed, progress to non-opioid analgesics like Tylenol or ibuprofen. And then, if needed, opioid analgesics if those are necessary. As a registered nurse, and it is important to make a difference in the healthcare with opioid crisis. It is important to provide awareness to the current public health crisis. Stay educated and informed as a registered nurse on treatments and developments. Remain sensitive and reduce stigma surrounding opioid misuse. Educate patients and families on safe opioid use, potential side effects, dangers of using them, and safe storage and disposal to prevent anyone from accessing these. And advocate for patients and increased access to care in the community. Advocating for your patients who are at risk and are opioid addicts. These are my references, and that is my presentation. Thank you.